Okay, good afternoon, everybody. This is Santosh here from Innovative Alliance for Public Health. It is a voluntary nurses association who give 10 minutes per day time for the professional developments and 0.1% of their net income for the professional development. They need not to pay directly money to us, but they can invest this money in their professional development. With that principle, we started this initiative, and we are still we could able to do a lot of things which we can do. As a part, there is a lot of currently there are some changes in the nursing profession uh, which you would have heard of. Recruitment in the nursing should be only male nurses or female nurses or both should be there. There are many ways to go. There are many discussions, and AIMS, All India Institute of Medical Sciences, the central board has decided to take 80-20. So there were this created a momentum. That's a peg of the discussion everywhere in the nursing and nurses now, saying that why is it so? So why? What are the arguments of it? There are many arguments which we heard of. We are in discussion with the some of the stakeholders of that meeting, that CBI, AIMS, and some of the policymakers. Some of the arguments are that default, there are only 20% of the male nurses are coming in the profession, so let them be there. It doesn't make any changes. Number one. Number two, they say recently there increased number of nurses in the central government, male nurses in central government recruitments. That is the reason we want to reduce it. Why do you want to reduce it? It's a patient's perspective, they say. That's the second argument. There's a but nobody is looking after how is the trend. Were the male nurses existed every time from when they started? So we were, I was, our group thinking, why is there any such a history written everywhere? Then we started to collect some information and started to look at it, and we did not have anything. Then we requested our many of the scholars and the scholars to tell us how it is. One among them who willingly came forward and said that it's very important. Let's discuss as a starting is Professor Dr. S. Annie Grace Kaliamati, who is a registrar of Tamil Nadu Nurses and Midwives Council. Sorry, I wrote double E. The spelling may be wrong. Pardon me if I'm there. I'm bad in that. Thank you. So let us know. I will not take much time. I'll read out the instructions which we need to follow to all the speakers when they all the participants. Yeah, okay. I'm new to this, but I'll share the screen. Well, yeah, here. Yeah, sorry for. Yeah, instructions to all the participants. I will not enlarge it. It can be visible. I'll read out. Please keep your video and audio on mute unless you are supposed to speak. To make you clear, in the left side of your computer screen, there is audio. Please mute them, and video also, so that our conversation will be comfortable. Number two, please close or turn off or mute other apps. For example, if you're using the WhatsApp app or you are using some Skype, please switch that off. If you have any issues related to connections, please WhatsApp on this number. We'll reply to you. And most of the time, the screen will be the one who is speaking with a screen, or else there will be a PPTs presented by a speaker that will be there. If you have any questions, please do not hesitate. Please write it on the Q&A session, which you can see on your screen. If needed, if your questions are not answered, we will be having these conversations going on in the coming days. It's a series of webinar. First, we are starting in